Which of the following is the term for the functional unit of compact bone? A. Lamella. B. Haversian canal. C. Osteon. D. Trabeculae. The answer is C. Osteon. The functional unit of compact bone is the osteon. The osteon is formed by concentric layers of compact bone called lamellae. These surround a central canal called the Haversian canal. Trabeculae are the functional units of cancellous, spongy, bone. Which of the following cells is responsible for depositing hydroxyapatite into bone matrix? A. Osteoclasts. B. Osteoblasts. C. Osteocytes. D. Myelocytes. The answer is B. Osteoblasts. Osteoblasts are the cells responsible for the deposition of hydroxyapatite into bone matrix. In addition to hydroxyapatite, they synthesize collagen, osteocalcin, and osteopontin. Osteocytes are undifferentiated osteoblasts, while osteoclast cells function in opposition to osteoblasts by removal of mineralization from the bony matrix. Myelocytes and normoblasts are both hematopoietic cells of the bone marrow and do not take part in bone mineralization. Which of the following is in the Haversian canal? A. Red bone marrow. B. Periosteum. C. White bone marrow. D. Capillaries and nerves. The answer is D. Capillaries and nerves. The Haversian canal allows capillaries and nerves to pass through the cortical bone to nourish osteocytes, osteoclasts, and osteoblasts. Both the white and the red bone marrow are contained within trabecular bone, while the periosteum is a thin, highly innervated membrane on the outside of bone. In regards to bone marrow, red marrow is primarily made up of underscore cells, while yellow marrow is primarily made up of underscore cells. A. Hematopoietic. Fat. B. Proliferating. Calcified. C. Active. Dormant. D. Erythrocytic. Leukocytic. The answer is A. Hematopoietic. Fat. Variation in color of bone marrow cells is not related to their level of activity, calcification, or the types of blood cells they produce. Rather, red marrow is primarily hematopoietic cells, both red and white progenitor cells, while yellow marrow is primarily composed of fat cells. Growth in long bones must occur at the dash. A. Epiphyseal plate. B. Diaphysis. C. Suture. D. Epiphysis. The answer is A. Epiphyseal plate. Growth in long bones occurs at the epiphyseal plate, a region of hyaline cartilage at the metaphysis of the bone. In adolescents and children, cartilage cells are ossified by osteoblasts to increase bone length. Once adulthood is reached, the epiphyseal plate becomes the epiphyseal line at the junction of the epiphysis and the diaphysis, the center of the bone. The diaphysis and epiphysis themselves are composed of mature ossified bone and do not proliferate, they are simply added to by transformation of cells in the epiphyseal plate. A suture is a fibrous joint of the cranium and does not contribute to the development of long bones. The length of long bones is increased via the hypertrophy and eventual apoptosis of chondrocytes, which leave cavities that are then colonized by osteoprogenitor cells. This process is referred to as A. Osteoblast mineralization. B. Apoptotic ossification. C. Endochondral ossification. D. Endochondral mineralization. The answer is C. Endochondral ossification. Long bones are lengthened during childhood and adolescence via a process referred to as endochondral ossification. In this process, chondrocytes of the growth plate hypertrophy and eventual die, leaving cavities that are then colonized by osteoprogenitor cells. These osteoprogenitor cells then differentiate into osteoblasts, which mineralize the newly forming bone. None of the other answers are actual processes in bone formation or physiology. Which of the following is not a common site of hematopoietic bone marrow in an adult? A. Pelvis. B. Sternum. C. Skull. D. Tibia and fibula. The answer is D. Tibia and fibula. In adults, hematopoietic bone marrow is generally confined to the flat bones, including the sternum, the skull, the ribs, and the pelvis. Hematopoietic bone marrow also exists in the proximal end of the femur in most adults, but is not generally found in the tibia or fibula. Muscle is attached to the periostem of bone via which of the following? A. Articular cartilage. B. Sutures. C. Ligaments. D. Tendons. The answer is D. Tendons. Muscle attaches to bone via tendons, fibrous extensions of the sheath of the muscle body that are primarily composed of tightly packed collagen fibers. In comparison, ligaments attach bones to other bones without involvement with a muscle, such as the ligaments between the metacarpals of the wrist. Sutures are fibrous joints of the cranium, and hyaline cartilage is at the point of articulation of many bones, but it is neither incorporated into muscle structure, nor does it attach to the bone with which it articulates. Rather, articular cartilage primarily serves to allow bones to glide more easily over each other during movement.
The individual unit of muscle contraction in a muscle fibril is referred to as the dash. A. Sarcoplasmic reticulum. B. Sarcolemma. C. Sliding filament. D. Sarcomere. The answer is D. Sarcomere. The individual contractile unit of a muscle fibril is referred to as the sarcomere. These units are made of actin and myosin filaments and joined by Z lines. The sliding filament theory refers to the idea that muscle contraction is the result of myosin strands within the fibril pulling themselves along actin strands similar to pulling on a rope, which shortens the whole sarcomere. The sarcolemma is the specialized cell membrane around the muscle fibril, and the sarcoplasmic reticulum is the smooth endoplasmic reticulum found within the muscle cell.
Which of the following is the correct order of structures in a skeletal muscle, from largest to smallest? A. Fiber, fascicle, fibril. B. Fiber, fibril, fascicle. C. Fibril, fascicle, fiber. D. Fascicle, fiber, fibril. E. Fascicle, fibril, fiber. The answer is D. Fascicle, fiber, fibril. The largest unit of muscle tissue is the fascicle. Each fascicle is made up of a bundle of muscle fibers, and every muscle fiber is made up of many fibrils, called myofibrils.